Welcome back to the American College of Surgeons Bulletin Brief from the front lines, Surgeons' Voices. With me today is Dr. Neil Floch. Dr. Floch is the Medical Director of Bariatrics and Section Head of General Surgery at Newfont Health in Connecticut, and he is also a very important part of the American Society of Metabolic and Bariatric Surgeons and the journal Surgery for Obesity and Related Disorders for their social media programs. Welcome, Neil.
Thank you. Thank you for having me today.
Delighted that you could be with us today. You are known, of course, for your prowess in bariatric surgery, but also known throughout the world as a leader in social media, particularly in Twitter. So I thought we might take advantage over these next few minutes to talk about Twitter and its importance to surgeons. Therefore, maybe you could just start off and tell us, why should surgeons be engaged in Twitter?
Well, it doesn't matter whether you're an academic surgeon or you're, a surgeon who's in private practice, and there are not many who are just in private practice. But if you're patient-minded or you're academic-minded first, you really do need to be on Twitter. And when you look at social media, there's kind of a hierarchy, or the social media has become specialized. And just briefly, I can't talk about Twitter without talking about the other social media applications. Facebook is for your friends, for connecting to other people that are within your group. We've become actually segregated in social media. So Facebook will help you to different groups that are interesting to you. But and Instagram does that in a way too. You can see people doing different things and get into different groups that are specific interest. Where Twitter comes in is Twitter kind of has this hold over the entire globe. You can connect on Twitter to people in Taiwan or Burma or anywhere where there's a doctor if you're another doctor. You're not isolated to a group. So if you have a message that needs to get out there and to get out to the world, Twitter is the application that will do that. That is what the media listens to. That's what the news listens to. And if you want to influence others, it is through Twitter. As physicians, whether we're in private practice, whether we want to communicate with our patients, or whether we're academic and we want to communicate a thought, an idea, especially in COVID-19, we had new ideas and we had to get them across the world quickly and find other people who are thinking the same and work together and collaborate. We want to educate others. We want to educate individuals about, colorectal cancer and screening. Maybe it's some other new device we've discovered. Maybe it's a new finding. Our paper. We've written a paper and we want that to go across and get read by others. And you can't do that. You can't propagate it with any other social media as well as you can do with Twitter. So that's where it's very integral and important to all physicians and specifically surgeons. So if you've written a paper, you want to talk about your paper on Twitter. You don't have to wait for the media to come to you. You can be the media. You have the opportunity, and you really have to take advantage of that opportunity.
Thanks very much. It's important to put Twitter in perspective with the other social media platforms. I agree. So assume somebody who's watching and listening to us today is not engaged with Twitter, and they've heeded your words and want to disseminate their work and want to communicate with other surgeons around the world and or patients. How does one best get started?
Well, first of all, be you. Don't be someone else. People want to hear, and I did an experiment early on. I was me, I was my practice, and then I was kind of someone that I'm not, someone taking pictures with celebrities and looking like they're important. And clearly what patients want is they want to hear from you, Dr. Steve Wexner. They want to know about you. They want to know what you do. So first of all, be you, have a good picture, be professional, make your name Dr. Stephen Wexner or Stephen Wexner, MD. And people will need to find you, and that's the best way to find you. And then, get started and figure out why you're on. Are you on because you want to promote what you believe in? Maybe you have a belief in a disease that you want to promote, or maybe want to promote your work. And maybe you've had a very fascinating paper. You want to promote that paper and talk about it, discuss it, bring other people in and engage them, and follow people who are of similar beliefs as you, because they will help you and they'll help to propagate and amplify your messaging. And that's very important, that you do develop some sort of collaborative group, because you will help each other. And that group is usually not the person next door down the hall, is it? It's usually someone in Spain or in Italy or South America that thinks the same as you.
Important message, very important message. Now, one of the things that we hear about is you've got to be careful what you put on Twitter, any social media platform, obviously. And that even though you can delete something once it's been in public domain, it's somehow traceable, which brings to mind that there are clearly some safety checks. And maybe if somebody is going to get started with Twitter, first you could talk about some of the safety checks, and then I want to go into some of the more technical aspects of tweets. But I think just safe tweeting would be a good starting point.
Yeah, so in order to be safe, right now we know that we're on tape and we're doing an interview, so we're guarded. We're looking, we're looking our best and we're talking our best. And I think that is the same demeanor, the demeanor that you have when you're with a patient in the office, that you should on social media. Don't get out of emotional control. Don't start saying things that you normally wouldn't say in a professional forum. Don't talk about patients without thinking through the effects of that. HIPAA applies. You cannot have someone identified by talking about their case. It has to be an unidentified individual. And I'll change the age, the sex, certain things about a patient if it is getting somewhat specific, so that it can be more generalized. Remember, you want to propagate an idea and you have to protect patient safety. So unless you have their written consent, you can't talk about a patient. I would be careful in your language. I would always look at things two or three times. And if you're not sure, what I do sometimes is send it to a friend in a direct message and say, I want to tweet this. Do you see any problems with it? We have people that help each other and look. And just as you have editors of journals, editors of tweets as well, because that information can be extremely difficult to deal with if you've tweeted out the wrong thing. So if you hesitate, think twice, check, double check, triple check before you send it out.
Very, very sound advice. Absolutely very sound advice. Now, talk about the basics. Let's assume somebody hasn't been engaged in Twitter, and now they hear what you have to say, and they say, okay, I'm going to be, Dr. ABC, or at Dr. ABC. So I now have my Twitter handle. Setting about tweeting, we don't have time within the confines of this interview, but for some broad brushstrokes, how many characters, what is a tag, what is a hashtag? Talk about attaching images or links to things. Maybe just go over those couple of areas.
So first of all, we talked about starting off, be yourself. The next thing you want to do is start to follow people you like. It's okay to follow people. That's the only way that you will grow and be followed. But follow people that you know, and not the world celebrities. Follow your friends that you know are on it that will help you. And then start tweeting about things that you like or are interested in. Maybe there's an article that you can comment on. And when you do it, there's a little thing with a number sign. It's called a hashtag. And you want to use hashtags that will call out like people. For instance, hashtag colon cancer, if you're a colon surgeon. Or if you are interested in a movement, maybe, one of the movements, I look like a surgeon, women surgeons who are, who have come together for certain reasons, have formed a group and a message. And you link up with some of those individuals and calling them out with a hashtag as well. Now, the little A with a circle is sending a message to a certain Twitter site. Let's say I want the American College of Surgeons, or I want Steve Wexner to know about this because I think Dr. Wexner is going to retweet what I have to say. So I will direct the message towards him in the tweet, and he most likely will retweet what I have to say and help me out. Those are two things that are very powerful in each tweet. Now, we also know that pictures are important, and an emotional picture, a teaching picture, a piece of information that is extremely powerful to attach to your tweet. We know that it's going to make that tweet seen by more people, re-clicked by more people, or retweeted by more people. So it's very powerful to have pictures, and it's very powerful to have videos as well. So that's a good start. Now, now there are other things that can be done and achieved to the next level. Of course, we want to get to the next level by influencing others. If we influence people of power by what we say, they're more likely to retweet it. And that is the next step to get really seen by other journals, newspapers, and TV. That's Twitter 2.0 and 3.0.
Well, thank you. And you certainly have been a master of it with, as of today, something around 130,000 followers on Twitter, which, to put it in context for viewers and listeners who are not Twitterati, is a bit over double what we have at the ACS as an organization. So clearly you're devoting a lot of time and effort. The natural question would be, how much time daily do you put into Twitter?
So I woke up this morning and I spent a good, I would say 45 minutes just looking at articles and reading. And what Twitter has done for me is actually helped me to learn. And I've just educated myself on multiple topics where I couldn't do before because, you know, my learning style, I'm not someone who can go read a book. I have a borderline dyslexia. So I need to read things quickly. I read abstracts. I move through a lot of them. And, you know, throughout the day, you could say, well, I'm doing social media, but I'm also reading. That's kind of like replaced my journal reading time. So 45 minutes in the morning, sometimes that's an hour. And during the day, throughout the day, whether it's the middle of the day in between patients, I'll be on other social media platforms and at the end of the day. So it could be anywhere from at least an hour. It could be 3 hours on social media. It's a tremendous amount of time, but it also brings in other aspects of my practice. It's not just social media. It's promoting patients. It's interchanging with patients on Facebook. So you can't just say that that's social media, but I think people have to dedicate a certain amount of time and decide what they want to do with it, and then find the application that's important for their practice.
Thanks very much. And just the last few minutes, I want to cover some of the additional platforms within Twitter. And if you could just tell people a little bit about them. You mentioned the hashtag to get an interest group. There's also the ability to do polls with Twitter. There's also tweet chats with Twitter. And maybe you could just briefly explain those two areas.
So you are able to do polls, and polls are very exciting because people like to participate. People usually won't retweet or reply to something. They'll answer something that's anonymous. So it's a very powerful tool because you can get a quick feel as to what the public is thinking. Are healthcare workers, do they want to get vaccinated? Are people scared of going out because of variants of the virus? Do doctors believe that obesity is a big problem? You can get that feel from a poll. Polls are easy to do. There are only 4 options on a poll, and you can have the tweet last for anywhere up from a day to a week, and they're quite helpful. The other applications that are hooked up, there is video. Periscope, you can do live video, but that is going away very soon at the end of the month. But you will still be able to do video. And, you know, as far as tweet chats, that is a great opportunity to come together with other individuals across the globe and talk about a topic. And you pick a topic, you could write a blog about it, and you schedule the tweet chat and you advertise it. And then you discuss and add a hashtag. The hashtag will bring you to the Twitter chat. So Obesity Social Media is a Twitter chat that we developed approximately, gosh, it's about 3 or 4 years now. And we do it every month at a certain time on Sunday, 9 o'clock Eastern Standard Time. And individuals, many disciplines about obesity, we discuss it. And those tweets that are developed there then get propagated later on during the week as well. So it takes on a life of its own. Very powerful discussion. And it churns out a lot of information with 1 hour of time, which is a lot different than some of these groups that occur over days and weeks and months.
Thanks very much, Neil. I really appreciate your time today, your expertise, and look forward to reading and retweeting your tweets in the future. Thanks for all you do to educate people in this important technology platform.
Great. Well, thank you very much. And thank you for this opportunity.